We are having the SLX clear aligners for our patients now. These are sleek, they're transparent, they are awesome. You can barely see them when they're wearing them.
We are so excited to be presenting this to our patients. It's a new option that lets them get the treatment that they need and gives them the clarity that they want for something that doesn't interfere with their lifestyle.
Patients have been asking about this for a while. We have been considering other alternatives, but we feel like this is going to be a win-win-win-win for patients.
SLX aligners are made from a proprietary material called Clearwear. They are more clear than Invisalign, more accurate, better fitting, more comfortable, and hold more firmly to the teeth.
The SLX aligners are different from the competition because we are not going to be so dependent on the attachments to do the major movements that we had to do when we used other products like Invisalign, for example.
Invisalign might need 15 to 20 attachments. SLX clear aligners, probably 0.
So one of the great things about the SLX clear aligner, the system, they have this proprietary system where they will take each tooth and basically cut those teeth off in the models, and they can robotically move those teeth individually, compared to other systems where they just digitally do that and they have a computer magically come up with these movements that probably aren't happening that exact way. With some of the other products that are out there, they might take, I don't know, 20 to 40 different aligners. With the SLX clear aligners, it cuts that down about in half.
Do-it-yourself orthodontics is not going to be around for very long because patients will soon understand you want the supervision of a doctor.
A patient doesn't have the education or the knowledge to know if they're even a candidate for something like that. They might have some periodontal problems. They might have some decay that they don't know about, that putting them through this type of a system of treatment would actually make their problems worse.
How accurate really is that? Where with the SLX clear aligners, you're gonna come see an actual trained certified orthodontist. You're gonna come in, get a scan, okay? You're gonna meet us, you're gonna meet the team, you're gonna have an awesome experience, and then you're gonna get a product that works really well. Candidates for SLX, you're gonna tell them, yes, you are a candidate. You're never gonna tell them no. But the trained certified orthodontist will be the final determining factor. We'll sit down with them and we'll explain to them if they're truly not a candidate, the reasons why.
Many people have gone through and checked with orthodontists or dentists in the past and asked if they were good aligner candidates and if they could get their teeth straightened with something like these types of products. And many of them have been turned down because of problems with a lot of crowding or just too complex a situation.
We will go through the process. We will hold their hand along the way to make sure that the results they get are something that they're going to be proud of, something that will, this is an investment in their smile, so we want them to be happy forever.
The motion device basically helps us get the back teeth in the proper position, the proper biting position, so that we have proper function of the teeth. Once that's accomplished, then this next step is to then jump into the aligner treatment, and then that helps us fine-tune and get the teeth fitting just exactly the way we want them to be.
It's a bar that hooks on toward the back on the top and a little button on the bottom, totally hidden. These patients will be wearing rubber bands without the brackets. So we're actually fixing the bite without really seeing anything.
It looks like it is going to be speeding up treatment time quite a bit. It may even cut things down close to about half the time.
If you were not a good candidate for clear aligner therapy before, using the Motion 3D appliance, we can correct your bite first. It takes about 2 to 4, maybe 6 months of wearing some rubber bands. Fix your bite so that instead of crowding, you now have spacing and you are a good candidate to wear the clear aligners.
With the Motion appliance, what that does is it gives the patients the understanding that, hey, I got to step up my game. I got to do things. I got to prove to myself, to the orthodontist, to my parents, then I'm gonna follow through, because they know that unless they follow through with this, we really can't move on to the next step.
So one of the great things about this Motion 3D appliance, we're gonna be fixing the bite when the patient is excited, when they're ready. They think they're getting braces on, but no. We're actually fixing their bite first. Traditionally, we've spent a year or more already leveling and aligning, getting the bite and the smile pretty. Now we have to fix the overbite. Patients, the cooperation they're just not there. They're not pumped up and excited anymore.
With using the motion appliance, we actually take a step back from that and say, wait a second, we can immediately jump on and take care of some of the most difficult treatment at the very beginning.
And I think with the introduction of this motion appliance, if we do this first, this is going to give us much better outcomes. We're going to get through treatment much faster. It's going to clear up a lot of our schedules. It's going to be amazing. It's going to be absolutely wonderful.
Your orthodontist at Risas will be very flexible. If you're currently in metal braces, with the launch of these clear aligners, the SLX system, if you don't want to continue wearing your braces, we can revise things, no problem. We'll halt your braces movements, we will scan your teeth to start making the clear aligners, and then about 2 weeks later, the aligners come back, the doctor will take off your braces and start your aligner therapy.
Our current patients that are wearing braces, they will have the opportunity to switch to the SLX clear aligners and use the Motion 3D appliance if we haven't fixed the overbite yet. That's going to be the call of the certified orthodontist. They'll be able to make that decision with the patient.
This will give us an opportunity to go ahead and maybe pause, take the braces off, use the motion appliance, get people back into the proper position, and then even give them an option to use clear aligners at that point so they don't have to still have the braces that many people don't really like having to have.